Categorized as a pandemic by the World Health Organization, the coronavirus COVID-19 has now reached 150 countries, territories, and areas. A situation report by the Center for Disease Control in the last 24 hours says there are 167,515 confirmed cases globally, including 6,606 deaths. In China, there are 81,077 confirmed cases, including 29 new cases, and 3,218 deaths. 14 of these are new. In summary, outside of China, 86,438 confirmed cases have been reported and 3,388 deaths. 150 countries, territories, and areas have now been reached by the coronavirus COVID-19. According to the Coronavirus Resource Center website of Johns Hopkins University and Medicine, the total number of COVID-19 patients who have recovered is 80,840. The CDC says a pandemic is a global outbreak of disease. It happens when a new virus emerges to infect people and can spread between people sustainably. And because there is little to no pre-existing immunity against a new virus, it spreads worldwide. At a media briefing on COVID-19 on March 11, WHO's Director General Tedros Adhanom cautions that pandemic is not a word to use lightly or carelessly. It is a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Here in the United States, as of 12 noon today, total cases reported are at 4,226, and the total deaths is at 75. Jurisdictions reporting cases are at 53, and that includes 49 states, the District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands. CDC says data include both confirmed and presumptive positive cases of COVID-19 reported to CDC or tested at CDC since January 21, 2020, with the exception of testing results for persons repatriated to the United States from Wuhan, China, and Japan. State and local public health departments are now testing and publicly reporting their cases. In the event of a discrepancy between CDC cases and cases reported by state and local public health officials, data reported by states should be considered the most up-to-date. Across the U.S., a great number of schools and dine-in restaurants have temporarily closed. Some cities have banned large gatherings. Public events and meetings have been canceled. Sporting events have also been canceled. In some states, gatherings with 50 people or more will not be permitted. Here in Washington, D.C., events at several embassies have been postponed for later dates as well. Today, we will check in with our North America correspondents for updates about the COVID-19 situation in their cities, states, and provinces. But before that, joining Eagle News today is a geriatrician from Palo Alto, California, Dr. Minerva Navarro. Dr. Minerva Navarro, thank you for joining us.
Thank you for having me.
Dr. Navarro, you are a geriatrician, and that means you specialize in services in senior care. Amid the spread of coronavirus, COVID-19 across countries, how do you handle the pressure, especially those that you care for are categorized as higher risk patients when it comes to being infected?
It is not surprising that the senior population is the highest risk with this new virus. It is really supported by the physiologic changes in aging that seniors would have a lower immunity than the rest of the younger population. Mm-hmm. So as we learn more and the information evolves around COVID-19, all the healthcare professionals, including geriatricians, we follow the same CDC guidelines, mm-hmm. State public health, and most especially local public health recommendations. So since the healthcare system resources are also scarce, we started triaging the care for the seniors. We started offering virtual visits, phone visits to minimize the physical exposure risk, both for the senior itself and for the healthcare workers. The other thing that we're doing is we have been building policies around care for seniors, especially for the senior communities, like skilled nursing facilities, assisted living facilities, independent living facilities, where there may be communal areas for the seniors and families to congregate.
Thank you, Dr. Navarro. Is it true that those who are asymptomatic are more than likely carriers of the virus too? And then since they're asymptomatic, we can't really tell if they're infected. But how dangerous is that when it comes to our senior population?
Again, as we learn more about this virus and the CDC and the public health provides us evolving information, we are learning more about asymptomatic cases. And as you mentioned, because they have no signs of symptoms, they become much more dangerous in terms of public safety. And this is the reason why many county public health has adopted they call homing shelter, or staying at home as much as possible and just doing businesses outside your home when it is essential. So we are still learning a lot about this virus. What we can advise is, if you have no business going outside, stay at home, and obviously you would like to minimize your exposure with anyone other than what is necessary.
Okay, doctor, if you suspect you have the virus, if you're showing symptoms, which are flu-like, that's what they said, what should you do first?
Regardless of age, I would say definitely if you are showing any respiratory symptom, so make sure you call your provider. Your provider can advise you. So the healthcare system, as I said, is being tested right now into innovative ways of seeing patients outside the usual brick wall buildings as we speak. And so when you call your provider, there will be several ways that your visit may be addressed. So obviously we would like to triage the care based on your risk factors, your symptoms, because there are higher risk symptoms, and obviously your other comorbid situations. So right now we're offering, most organizations or medical groups are offering phone visits, virtual visits, drive-through visits, segregated respiratory unit visits, and we're also postponing other non-elective visits. So go seek out help. And then after you have contacted your medical provider, it would be good to isolate yourself. Not just home isolate. If you have other people in your home, it may be worthwhile getting yourself in other, in a separate unit in your home, or a separate room in your home. Obviously, just follow the universal precautions as everybody else talks about. Those are my main advice.
Okay, Dr. Navarro, what about preventive measures? Some are asking, since there's no cure yet, or it's the virus is still being studied, what preventive measures or could we take? Let's say, for example, when it comes to things we eat or exercises that we do, are there things that could help?
Generally, obviously, we follow healthy lifestyles. We are less likely to be affected by, infections, whether they are old infections that we know, like influenza, or novel viruses like the coronavirus. So having that balanced meal, throughout the day, drinking water or fluids if appropriate for your care, 30 minutes of exercise, sleeping enough, which is very hard to do in the United States. And then obviously universal precautions. As I said, some of these things are not really new. Hand washing, covering your mouth, making sure that you stay away when you're sick or stay away from sick people. I would say respiratory infection general respond well when you have good vitamins intakes. So those vegetables, fruits, they work quite well. They work quite well with your immunity as well as proteins.
Dr. Navarro, we know you're a very busy lady, and you have a baby also. Before we let you go, one last question. People are scared right now, especially because there's a lot of unknown about the behavior of the virus. As a medical care provider, how do you address your patients' fear? Especially, we've mentioned earlier, they belong to the higher risk category.
So, getting the right education is one thing. There's so much social media out there that may create panic and fear. I would say if you would like to know more, get in tune with CDC, your state public health, and obviously your local public health guidelines. Many public health has set forth ordinances that are legally enforced. I would say be good citizens, follow the ordinances, and use the support of the community. We are stronger than this virus. Get connected with your family, hopefully virtually. If you have ways to getting in touch with your family, not necessarily to be there physically. And then we just have to support each other. If you do have questions for yourself, there are ways to get hold of providers over the phone. There's also resources from the state and the local public health in alleviating fear from the public. And these are usually phone calls, and they can let you go through it. So feel the community. Let's be a community as we go through these new times.
Thank you very much for making yourself available to Eagle News, Dr. Navarro. We hope you could join us again next time.
Thank you.
There we have it. As she says, stay informed and keep safe, and panic is unnecessary. EBC's international coverage of the coronavirus COVID-19 pandemic will be right back. Stay tuned.
Congratulations to EBC Films Creative Director Carlo Ortega Cuevas for receiving the Film Ambassador Award for the film Guerrero from the Film Development Council of the Philippines. To God be the glory.
Welcome back. You are watching EBC's international coverage of the coronavirus COVID-19 pandemic. I am Eliza Gonzalez Manglekmont. The race is still on to come up with an effective vaccine against COVID-19. To update us on the latest in its development, we have Eagle News correspondent Ace Ramirez of our Washington, D.C. bureau. Thank you for joining us, Ace.
Thank you so much, Eliza. According to the National Institute of Allergy and Infectious Diseases, or NIAID, in collaboration with the biotechnology company Moderna Incorporated, based in Cambridge, Massachusetts, they have started phase 1 clinical trial of the vaccine called mRNA-1273. 45 healthy adults from ages 18 to 55 will be administered different dosages of the investigational vaccine in a period of 6 weeks at the Kaiser Permanente Washington Health Research Institute in Seattle, Washington. According to Johnson & Johnson, the chief scientific officer, he said their clinical trials are expected to roll out in November 2020. Pharmaceutical giant Pfizer is teaming up with BioNTech here in the US and in Germany, and is expecting to initiate clinical trials next month. Pfizer has also started development of the vaccine with a Chinese company in China. Biggest cloud of hope came from Regeneron, whose approach is developing a vaccine that treats and prevents the COVID-19 virus. The preventive therapy is in full speed, and Regeneron said they aim to have it out by this summer, causing its stock prices, of course, to shoot up. Although all these are just in the beginning phases of vaccine testing, and as experts say, it takes about 18 months to fully develop a vaccine and have it approved by the Food and Drug Association, the goal to fight and eradicate this global pandemic is within reach, with the concerted efforts of government agencies, the private sector, and of course, the cooperation of the people. In Washington, D.C., Ace Ramirez, Eagle News, we live in interesting times.
Thank you very much, Ace. Now that you have so much time in your hands, what do you do at home?
We'll spend more time with the kids. We're experimenting in the kitchen, taking long walks. It's really surprising. People around us, especially here in our area, it's like normal living. Kids playing basketball in the park. Traffic is less congested, of course, but it's pretty normal. You can't really feel the fear in the air, except when you go to the supermarkets where you see empty shelves. But pretty much it's normal.
Well, that's nice to know. Thank you for joining us, Ace.
Thank you.
With us also is Eagle News correspondent of our Washington, D.C. bureau, May Bondoc Ramos. May, what's the latest?
Thank you, Eliza. The latest number of positive cases of COVID-19 in Washington, D.C., as updated by the coronavirus.dc.gov, has now jumped to 31, having added 9 new cases who are all male, with age groups ranging from 28 to 61-year-old. This development has led Mayor Muriel Bowser to order all restaurants in the nation's capital to close starting today, but takeout and deliveries are still allowed. The establishments that are also affected are health clubs, spas, massage parlors, and theaters, which are all closed until April 1. But these small businesses, which are heavily impacted by the coronavirus, are now told that they can apply for federal relief funds. Also, DC public schools are open with limited staff on weekdays between March 16 to 24 for students to pick up essential items such as books or medication. Meals are also available to any student at sites across the district up to March 21. On another note, local homeless shelters are also facing challenges. Even the basic proactive measures such as washing hands or the having alcohol for them, they are actually a challenge for the homeless. It has been a challenge in the homeless community. According to Joseph Menimano, the president of the nonprofit Central Union Mission, EBC, they have taken an extra step in taking the folks' body temperature upon checking in. If one has sign of fever, they will be sent to get medical attention. On a lighter note, though, outdoor recreation will remain open, including playgrounds, tennis courts, and basketball courts. So kids and kids at heart can still enjoy the outdoor. It's almost spring and the weather is getting warmer. In Washington, D.C., May Banda Cremas, Eagle News, we live in interesting times. Back to you, Eliza.
Thank you very much, May. You mentioned that playgrounds are still accessible. You have 2 toddlers. How do you handle it with 2 boys who more than likely would always want to play outside? How do you do it?
We were just outside this afternoon. We were just in the playground, and it really is a nice weather. So we're just enjoying it outside, but keeping in mind that social distancing is still important, 6 feet away from anyone.
And constant washing of hands. Frequent,
Yes.
I mean. Thank you, May. Thank you for joining us.
Thank you.
With us also is another Eagle News correspondent of our Washington, D.C. Bureau, but he is right now in Fort Washington, Maryland, to update us on COVID-19 situation in Maryland. Ken Cruz.
Thanks, Eliza. As of 9 p.m. Eastern Standard Time, March the 17th, the state of Maryland has 63 confirmed cases of the new coronavirus, with 22 cases added just within the past 24 hours. This is the largest per-day increase so far. The governor of Maryland, Larry Hogan, announced today that the primary election scheduled for April the 28th will be postponed to June the 2nd. Governor Hogan also declared plans to have all vehicle emission sites to be repurposed as drive-through testing centers for COVID-19. Like in Washington, D.C., gyms and movie theaters have been ordered to shut down, with restaurants limited to takeout or delivery only. Settings of 50 or more individuals will be prohibited across the state, including social and recreational events. State police and local enforcement agencies said that they were prepared to arrest those who deliberately disregard these directives. In sports, Maryland native and NBA superstar Kevin Durant is one of 4 Brooklyn Nets players that have tested positive for coronavirus. KD has not had symptoms and is reported to the local news today that he is feeling okay and he wishes everyone well. In Fort Washington, Maryland, I'm Ken Cruz, Eagle News. We live in very interesting times.
Thank you, Ken. Ken, we know very much that you're a very sports-minded person, and I think your favorite sport is basketball. How do you get by now? Because basketball is a contact sport. How do you get by now that more than likely you're a little bit limited to playing the sport?
Definitely. Basketball, volleyball, it's extremely challenging to find different workouts. I'm on YouTube a lot, looking for at-home workouts. I also did 2 miles today since the weather is very rarely nice. I think it was 64 degrees Fahrenheit. So that was nice. Also, I'm not worrying about taxes since they just announced federally that they are postponing it for 3 months. So now I'm a little bit at ease. That's kind of freed up my mind. Also, spring cleaning is a little early, so that's how I've been keeping up my time.
Well, that's good. That's good to know. Thank you for joining us, Ken.
Thank you, Eliza.
We're still on the East Coast. Joining us today is Jennifer Paulinton in West Nyack, New York. Hi, Jen.
Hi, Eliza. Thank you for having me. I'm reporting here with the latest stats from the New York government health pages with 432 additional confirmed cases, bringing our total here in New York to 1,374. Because of the increased number of cases, Governor Cuomo has reached an agreement with legislatures to pay for sick leave and for job security for any of those who test positive for COVID-19. Also today, drive-through testing opened in Nassau County, followed by the success in Westchester. An agreement was met last night with New York City health officials to administer 5,000 tests daily. Mayor de Blasio is calling on 9,000 licensed and retired workers in the Medical Reserve Corps to come forward because of the need for medical professionals. Today was also the first day that restaurants, bars, and cafes were banned from seating patrons and are now limited to just takeout or delivery. Also, for rideshare, for Ubers, for Lyft, and other car services, they're all banned as well to promote social distancing. Another source of contention was school and education being closed and now switching over to remote learning, which will begin in New York City on March 23rd. And a lot of families were concerned that families would not be able to partake in the free breakfasts or the lunch programs. But now sites are being set up for pickup, and we actually have people who are going to be designated to deliver to special places or to places that will be easily accessible for families to be able to partake of the free food and the free lunch. So it's really nice to see communities coming together in this time of crisis. Jennifer Paulinton, New York. We live in interesting times.
Thank you, Jennifer. And yes, that's true. It's very nice to know that communities are coming together in this time of uncertainty. But I'd like to ask, New York is the city that never sleeps. And
Yes.
if people cannot dine in restaurants, let's say in Times Square, like you, as a mother of two, how do you do it? How do you adapt to it?
I would like to say, and I'm afraid to admit this, but I don't cook. So I'm well versed in ordering takeout. So it's nothing new for my family to do takeout and delivery. I have Grubhub and all the apps accessible. So luckily for me, Grubhub and DoorDash are offering free delivery without any surcharges. And there's also a lot of local restaurants here who are now doing delivery as well, or you could do curbside pickup. So I think my kids actually like it better that I'm not cooking and that we could do takeout. So it's a different kind of adventure for them.
Good for you, Jen. Thank you. Now with us also is Eagle News correspondent in Newark, New Jersey, Elle Aguilar. Elle?
It's 11:02 right now in the eastern seaboard. The Newark Penn Station is one of the major transportation hubs in the East Coast. Normally at this time, people are coming in and out of this door to catch the train and the bus. Tonight, this is what you can see. Empty. Empty. Today should have been a very busy day because every year there is this tradition that most Americans take part of. Americans celebrate almost all day attending parades and other festivities. In other words, this day should have been a big deal for them because today should have been the day where they meet and greet their friends and families. They get to go out and eat and they do a lot of fun stuff. But unfortunately, because of COVID-19, people stayed indoors. Obviously, there's no place to go due to early closures of restaurants and bars and non-essential businesses. They're all closed. As you can see right here in Pennsylvania Avenue in Newark, New Jersey, or better known as the Penn Station, it's empty. See the taxi right there? No passengers. It's really complete darkness. But despite yesterday's announcement by the three governors from New York, New Jersey, and Connecticut banning gatherings of 50 people and implementation of the social distancing, this is what we know right now as of this moment in New Jersey, according to the New Jersey Department of Health. As of today or tonight, 267 positive cases are reported, 3 deaths so far. 670 hotline calls were received just within the 24 hours time. And overall total of phone calls they received, the Department of Health received 7,954. So that's our update right now. It's a lot less than New York City, but of course the local officials are still trying to remind everybody to be careful and of course avoid discretionary travel, no shopping for now, no social visits, no hanging out for now. I know you miss friends, but use the technology. Do the FaceTime, you know. Avoid eating or drinking in restaurants and bars. Actually, even though they close early at 8 o'clock, some restaurants are still open for deliveries and for takeout. So take advantage of that. And it's cold anyway, so it's better to stay indoors. Do not visit nursing homes or retirement or long-term care facilities. In fact, a lot of facilities, healthcare facilities, are now banning the visitors. They're not allowing visitors unless it's a hospice care patient. So be careful of that. And also, best of all, always wash your hands. Always observe the proper hygiene. On another note, here in New Jersey, a lot of supermarkets are limiting the number of products that every customer should get. You know, we heard so many stories about panic buying. People are really going crazy about buying different items, especially cleaning materials, disinfectants. Well, at this time, New Jersey supermarkets are limiting the amount of what you can buy. And also they're closing early. Some used to stay open 24 hours, but now I believe some stores are closing at 11 o'clock, just so it will give them time to restock and clean the area. In that way, when customers come in, at least they know that it's disinfected, everything is okay, let's hope. So anyway, that's our update right now from Newark, New Jersey, El Aguilar. We live in interesting times. By the way, a lot of people are wondering, the social distancing, right? If you're not aware or if you're wondering what is social distancing, the 6 feet, this is the easiest way to do it or to determine it. Just do your hands like that, and then if one person is doing that, there you go. You should be okay. But, you know, I'm not saying that 6 feet, but it should be at least the ballpark.
Thank you very much, Elle. Before you go, I have one more question. You spend a lot of time with your mom, and you guys always travel. You go shopping together. You go grocery shopping together. How do you keep her occupied at home? I'm pretty sure you discourage her from going out, especially these times. How do you keep her occupied?
It's funny you say that because to keep her occupied, it's not a problem. She moves around all the time. So she's watching
Good
TV.
for her.
She does exercises. She talks to her plants. She loves her plants. You know, she cleans a lot, and we let her because it makes her moving all the time. You know, not like other people. They just like staying in one place and watching TV. But she likes to move around. But the only thing I always tell her is not to go out. Not even get the mail outside because it's dangerous now. She's 80 years old. But thank God she's healthy.
Thank you. Thank you again. Send her our regards.
Thank you.
Now, before we go on break, joining us tonight is our Eagle News correspondent in Corpus Christi, Texas, Kathleen Gregorio. Hi, Kat.
Hi, Eliza. We're here in Corpus Christi, and fortunately, here in the coastal Bend area, we still do not have any reported cases. However, in the entire state of Texas, there are a total 64 that are infected. In fact, in some of the major cities, such as Austin, Texas, which is the capital of Texas, the mayor has issued a statement stating that mass gatherings of no more than 10 will be allowed, but after that, they are restricting that, and it's a rule, and it has caused many restaurants, many dining establishments, even like fast food franchises that are very well known. It caused them to close, and many are doing only drive-through only basis. Here in Corpus Christi, we're actually going to start having the drive-through testings implemented, with the priority being the first responders. That's going to start tomorrow. We're expecting that it's going to we're gonna have a lot of people that will be, of course, signing up to be tested. One of the issues that happened in other places is that there were test kits that had run out, but today Governor Abbott had declared that they will be issuing at least 15,000 more test kits to be distributed to the state of Texas this week. So far, that's our updates. Reporting here from Corpus Christi, I'm Kathleen Gregorio, Eagle News, 1 we're 25.
Thank you, Kathleen. Now, you are a hiker. You always are on the trail.
Oh,
is it still okay to go on the trail these times? Do you still go?
Well, one thing I can say is, according to the National Park Services Department, and it's even stated on their website, that some national parks are still remaining open. One of the biggest national park in Texas happens to be Big Bend National Park, and although some parts are restricted, like entrances and anywhere that's like some of the entrances or ports of entry or visitors information center, according to the Big Bend website, they are still allowing the park to be open because, as nature trails, hikes, where people have to be like within a required 6 feet distance from one another. It's a natural. It creates for a natural social distancing. So if if anyone is looking for a place to get out because they've been so maybe kind of having cabin fever from staying inside all day, visiting your national, local, or state park could be an option, but you need to check their website to make sure that you're following the restrictions or the instructions that they have provided.
Thank you again, Kathleen.
Thank you.
Another hiker joining us today is Eagle News correspondent Alfred Esenes in Honolulu, Hawaii. Hi, Alfred.
Aloha, Liza, and to all our crew around the North America. Yes, I'm always behind the wheel around this time, which is 5:12 p.m. Hawaii time, and I apologize for the gloomy skies because of flash floods that we just had earlier today. But that's not why I'm reporting. I just wanted to demonstrate, if you guys saw me earlier, this is actually a faster than normal commute for me, for obvious reasons. A lot of the residents here and even the tourists are pretty much hunkered down or have just chosen not to be out and about today. But let me just run down our situation by the numbers. As of 4 p.m. earlier today, Governor Ige made an announcement. There are 14, let me say that again, 14 confirmed cases of COVID-19, the bulk of which is 8 on the island of Oahu, 3 on Maui, 2 on Kauai, and the newest one is on Big Island. So in essence, all 4 island groups have COVID-19 cases. So far, there's at least 1 or 2 in which involved a community spread, in which, unlike the majority of the cases here, which involved travelers who vacation here in Hawaii or got the disease from somewhere else, These are from local residents themselves. The first one that was discovered was from Kualoa Ranch. For those who are not familiar with that place, that's the backdrop used for Jurassic Park and a few other movies. And as a result, sad to say, that attraction had to be closed until further notice. The second local case of COVID-19 involved a healthcare staff worker at one of the major hospitals in Honolulu. Now, speaking of the hospitals, a lot of the big ones here have set up almost like a triage tent or a separate or segregated facility in which they can screen patients for COVID-19 and separate them from those that seek normal services. So we'll see if we can get an update for you later in a few days. But that's just the update I wanted to share with you all, and on top of everyone else that's covered so far. We do have a lot of changes here, from limiting crowds to no more than 10, to the closures of major attractions to include, like I said, Kualoa Ranch, and now the USS Arizona Memorial, where at Pearl Harbor, and Blaisdell Center, Blaisdell Arena, and them facilities. That is really a big concern for the state that depends on revenues from the tourism industry, the number one industry here in the state. And right now, from my last report, experts have estimated about close to $250 million that will be lost in the next fiscal year. And the state will have to come up with funding somewhere else because of these closures and suspensions. It's losing money as we speak. So that's something that we're going to track as far as the long-term effects of COVID-19. So that's an update for you. And one positive note, I mentioned the traffic already, and yes, some of the kids here are on their day off because it's also spring break in the public schools as well as the University of Hawaii. But some of us, turn the camera around. Some of us still have to commute to work until further notice, because some of us are what you call mission key and essential personnel for other fields. So, reporting from somewhere on the road in Hawaii, I'm Alfred Asenas. We live in interesting times. Back to you.
Thank you, Alfred. Looks like you're enjoying the very good flow of traffic right now.
Oh, well, yeah, the flow of traffic, but the fact that I still have to go through here every day is another story. Thanks, Eliza.
Thank you for joining us. The White House released what it calls the President's Coronavirus Guidelines for America. To help with the 15 Days to Slow the Spread campaign, here are some of their recommendations. 1, listen to and follow the directions of your state and local authorities. If you feel sick, stay home. Do not go to work. Contact your medical provider. If your children are sick, keep them at home and do not send them to school. Contact your medical provider. If someone in your household has tested positive for the coronavirus, keep the entire household at home. Do not go to work. Do not go to school, and contact your medical provider. If you are an older person, stay home and away from other people. If you are a person with a serious underlying health condition that can put you at increased risk, for example, a condition that impairs your lung or heart function or weakens your immune system, stay home and away from other people. The guidelines also include instructions on how to do our part to slow the spread of the coronavirus. It says, even if you are young or otherwise healthy, you are still at risk and your activities can increase the risk for others. It is critical that you do your part to slow the spread of the coronavirus. If you work in a critical infrastructure industry as defined by the Department of Homeland Security, such as healthcare services and pharmaceutical and food supply, you have a special responsibility to maintain your normal work schedule. Avoid social gathering in groups of more than 10 people. Avoid eating or drinking at bars, restaurants, and food courts. It is suggested to use drive-through pickup or delivery options. Avoid discretionary travel, shopping trips, and social visits. Refrain from visiting nursing homes or retirement or long-term care facilities unless you are to provide critical assistance. Practice good hygiene, and this includes washing your hands, especially after touching any frequently used item or surface. Avoid touching your face. Sneeze or cough into a tissue or the inside of your elbow. Disinfect frequently used items and surfaces as much as possible. EBC's international coverage of the coronavirus COVID-19 pandemic will return shortly.
Mga kababayan, lalo na sa mga OFWs sa Middle East at North Africa, may good news kami para sa inyo. Mapapanood na ninyo ang Net25 at iba pang Filipino channels na hatid ng OSN sa presyong abot kaya. Libre na ang box at installation, walang admin fees at no extra charges. Saktong entertainment na sakto lang sa budget mo. Bumisita na sa pinakamalapit na OSN store o dealer. And subscribe now! Sa Net25 at OSN, siguradong at home ka dito.
Welcome back. You are watching EBC's international coverage of the coronavirus COVID-19 pandemic. I'm Eliza Gonzalez Manlakmont. Joining us today is one of our Eagle News correspondents in Vancouver, British Columbia, Kathleen Cruz. Thank you for joining us, Kathleen.
Thank you, Eliza. And as of today, 3 p.m., Provincial Health Officer Dr. Bonnie Henry has just announced a public health emergency here in British Columbia. Today alone, there are additional 83 cases of COVID-19, making the total confirmed cases to 186, with additional 3 deaths. According to Dr. Bonnie, there is a dramatic increase of people getting tested, hence why the testing sites have been expanded in the communities. BC Healthcare are also postponing non-urgent scheduled surgeries, creating spaces in hospitals and additional hotline for the British Columbians. In addition, all BC public schools will be closed until further notice in response to the pandemic. They are also working on making online classes available for continuity of learning, but this will vary from grade to grade and district to district. Small businesses are also taking a big hit because many had their doors temporarily closed, and many restaurants and shops are closed until further notice. But most of them are no longer taking dine-ins but offer drive-through. In Vancouver, Kathleen Cruz, Eagle News, will live in interesting times.
Thank you, Kathleen. Kathleen, Vancouver is a very much visited place in Canada. How are the residents coping when it comes to staying happy?
Yes, very much. People are still happy over here. Not a lot of
It's good to know.
fear. Yeah, so communities are helping each other. Apparently, there are some BC stores are open for seniors and individual who are at high risk. So there are some BC stores that are opening their first few hours just for the seniors and individuals who are disabled and who are sick, who are individually like high risk for this type of diseases. Many workplaces are also offered advising their employees to work at home to minimize the exposure. So as much as possible, stay home when you are if you can actually work at home. And many are still, but you can still see people biking and walking, hiking as well. But of course, following a social distancing. So,
Which is 6 feet or more.
which is 6 feet or more. Yes.
Thank you, Kathleen.
Thank you, Eliza.
With us today also is our Eagle News correspondent in Las Vegas, Nevada, Lani Valdecantos. Lani?
Cases, including one death. Now, these numbers might not sound alarming compared to the rest of the nation, but it is partially due to the fact that we are limited on test kits available to our state. Just an hour ago, our governor had actually conducted a press conference mandating that all non-essential businesses close effective immediately. These businesses include movie theaters, malls, gyms, and things of that sort. However, the establishments that will remain open are healthcare establishments, pharmacies, banks, and of course, grocery stores. In addition to the governor's press release, he is not instructing any religious organizations to stop any worship gatherings at this time, but is encouraging faith leaders to hold their worship gatherings not in person as much as possible. So this pandemic is also happening right before the much anticipated spring break here in Nevada. So a lot of families have had to cancel vacation and leisurely activities. So what's happening is it's greatly affecting our tourism here in Las Vegas, which has caused MGM properties and most of the hotels on the strip, such as the Wynn, the Venetian, as well as Cosmopolitan hotels, closing effective immediately. And this is causing a lot of layoffs and temporary and also indefinite layoffs that are happening. However, the governor has confirmed that evictions, due to the lack of wages from employees, evictions will not take place. So residents don't have to worry about their primary residence, as well as any essential utility shutoffs. Those will not occur. So, on the lighter note, Nevadans are hopeful. We have recovered from, as a community, we have recovered from unfortunate events in the past, but we are hopeful and have confidence in our local authorities that our safety and health of our residents is our top priority. In Las Vegas, Lani Valdecantos, Eagle News, we live in interesting times.
Thank you, Lani. I know you're a parent too, and now that they're on spring break, and looks like this spring break is going to be longer than usual. If you are limited to going outside, what are your plans when it comes to activities for the kids at home?
To be honest, my children have only been off of school for about 2 days. So I have actually just let them do what they want to do. So far, my son's been playing video games. My daughter has been busy on her TikTok, social media. So I'm just letting them have that space and that time to really enjoy the time off at this time. And then probably later on in the week, I'll have more productive things for them to do.
Thanks, Lani. Still on the West Coast, joining our coverage tonight is Ivan Sanchez in Lancaster, California. Thank you for joining us, Ivan. What's the latest?
Thank you, Eliza. So here in Los Angeles County, we have not so good news and we have good news. And not so good.
That's good.
Yesterday, 36 new cases of confirmed COVID-19 were found in LA County. Today, 50 new cases of COVID-19. So we're at a total of 144. That's the not so good news. The good aspect is that it means that there's more test kits going around, more people are being tested, more people know. And actually, there's a statistic that says 90% of the people that have been tested are coming out negative. So that's actually very positive. There's also been some not so good news in relation to employment, because we had a couple of days ago, basically the city kind of shut down all restaurants, all theaters, all gathering places. And so, you know, as employees, there's a lot of stress. But today the county announced that there's going to be a moratorium on all mortgage or rent evictions, and also even utilities. There's going to be a moratorium on cutting off utilities because people can't earn their money right now due to all the shutdowns. So there's bad news, but there's also good news here in LA. So this is Ivan Sanchez. In LA County, Eagle News, we live in interesting times.
Thank you very much, Ivan, for sharing with us the good news as well. And before we end today's coverage, joining us is a homemaker from Lancaster, California, who, like other parents, refuses to waste the opportunity to spend quality time with her kids now that they get to stay home from school for a few weeks. Today, she will share with us some pretty creative things they do to enjoy being together. Love Sanchez from Lancaster, California. Hello, Love. Thank you for watching us.
Hi, Liza. How are you?
We're good here. How are you?
I'm good. Thank you. It's been an interesting 2 days so far.
Mm-hmm.
My kids were out of school since yesterday. And as of yesterday, I have to be on my toes as a mom.
Love, we lost your audio.
Can you hear me now?
Yeah, you're clear,
Yes.
loud and clear. All right. Say
Maybe
that
my
again.
children were playing with the cords. I don't know. With children running around in the house, things happen. So like what I was saying, I have 3 children at the home right now. They were off of school since yesterday, and it will be 3 weeks for us that we'll be together at the home. And unfortunately, the weather here in Lancaster, it has not been great. It's either too cold or too wet to be outside. So we are sheltering in home. We are stuck at the home. But so I'm trying to be creative with them. Like my 17-year-old, he's always into learning new things. So he's going to pick up a new language. He's going to start to learn Spanish within the 3 weeks. My 13-year-old now has shown interest in trying to learn a new instrument. So he picked up his dad's guitar that's been collecting dust under the bed. And so now it's going to be put to good use. And I gave him a challenge that if he could play a good tune for me in the 3 weeks that he's home, then he'll have a reward at the end. And my 6-year-old daughter has now found interest in the kitchen, which is funny because I'm not really in the kitchen a lot. But I guess she picks up from grandma because she wants to learn how to bake now. So even from the morning, I have them help me in the kitchen with, you know, simple things, breakfast items, things that they can do while I'm supervising them. Because of course, I still don't want them to be full on hands-on in the kitchen. Because like I said, me, myself, I'm not even that great in the kitchen. But for little things, they can try to help me out with it.
Thank you, Love. You have 3 kids who are far apart from each other, but I commend you. You are one of the super moms who can think of so many ideas. So the kids will be productive, will be creative, despite what's happening around them. Thank you for joining Eagle News, Love.
Thank you so much.
And that is today's EBC's international coverage of the coronavirus pandemic North America edition. Thank you for joining us. I am Eliza Gonzalez Manglik Mott. We live in interesting times.
Innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges